柏金遜症咧就主要都係即係腦科，即係腦神經科嘅醫生睇嘅。精神科嘅醫生睇咧就係睇佢嘅情緒，睇佢嘅失智嗰方面嘅嚇，即係或者佢嘅幻聽幻覺，或者佢即係脾氣失控咁樣，嗰啲咧就係我哋睇即係情緒方面嘅。腦神經科 neurology 咧就係睇佢即係柏金斯症嘅本身個症狀，所以有親柏金斯症嘅人咧，就應該我估絕大部分都係腦神經科嘅人睇先㗎啦。
Generally a disease of elderly, so definitely older age is a risk factor for Parkinson's disease. Most patients get it if they do get when they do get Parkinson's disease, it's usually by the age of late 60s. It also can occur in younger patients too, so that's something to be aware of. Michael J. Fox, for example, being a primary example.
各位觀眾，你哋好。今日我會同大家講下一個比較普遍嘅老人病，叫做柏金遜症，又或者叫做巴金森氏症。呢一個病對於我嚟講係好有切身嘅感受，因為我媽媽係患有呢個病嘅。對於唔認識呢個病嘅人嚟講，佢哋以為柏金遜症只不過造成手震同埋腳震，唔係咁大不了啫。咁所以今日我哋請咗幾位醫生，同大家介紹一下究竟柏金遜症係一啲咩病嚟嘅呢？
柏金遜症咧係主要係一個腦裏邊兩邊嗰個我哋叫做底神經節 （basal ganglia） 嗰個問題。意思話咧，裏邊有一個介質叫做 dopamine， 咁嗰個咧就出咗問題。所有嘅介質咧就係腦細胞同腦細胞之間講嘢嘅方法嚟嘅，即係你點知道個細胞同細胞能夠講嘢咧，就係睇佢有冇將呢個介質嘅傳遞。個介質傳遞咧就係影響個信息。咁我哋而家知道即係腦神經細胞用嘅介質有好多種，主要咧就係幾種啦，dopamine 一種啦。catecholamine 啦 ，serotonin 血清素係一種啦，同血其實冇關係嘅，即係個名係咁樣叫啊。咁就monoamine oxidase， 即係咧通常呢幾種係叫大嘅介質，即係腦神經細胞溝通嘅一種方法，特別係影響個情緒啊，係咯。咁當然其他即係譬如好似你話，即係影響個身體嘅活動，有其他嘅介質啦，係咯。咁而家嘅治療咧，基本上面都係將佢呢個dopamine 嚟到正常化。咁一般你話點解底神經節會出問題咧？就確係同年紀有關啦。所以呢個病咧就喺中年之後或者50歲之後多，又唔一定淨係老人啦嚇。
Patients who in the case of Parkinson's disease, this lack of dopamine leads to them becoming very slow in their movements. Sometimes their face can look very almost expressionless. Their eyes may not blink as quickly. They can also develop a characteristic, what we call resting tremor, that their hand, generally the hand or the leg, but most often the hand, shakes in a very kind of slow rhythmic fashion, but when they're not doing anything with it. And that's almost the most common symptom that patients see that leads them to see the doctor. And they may also find their walking is slower, or they're not swinging their arms as much when they walk as well. And they can also affect their balance as well.
咁柏金遜症嘅來頭究竟係乜嘢嚟嘅呢？原來咧就係由發現呢個病嘅柏金遜醫生而得名嘅。佢喺1817年出版咗一個文章，而佢係第一個人去形容一系列嘅神經症候群。咁呢個咧就係日後叫做柏金遜症。咁究竟呢一個病嘅病徵係點樣嘅呢？
Parkinson's disease has what we call the 4 cardinal signs. So the primary cardinal sign is slowness of movement, or what we call bradykinesia. So it can be as subtle as just simply not swinging their arms as much when they walk, or that they have less movement in their face, things like that. Or it can be as severe as when they're just so stiff and they feel like they can't move, or they freeze when they walk. They feel like almost that they're stuck. The second key feature of Parkinson's disease is this characteristic resting tremor. So usually on one side of the body initially, and usually in the hand, that there's just a tremor that emerges when they're not using their hand for anything. But that tremor tends to get better when they use their hand to do things, at least early in the course of the disease. So that's another thing we look for. And then also walking problems, what we call postural instability. That patients with Parkinson's disease can also have problems with their balance, or when they walk, they may have what we call a shuffling gait or a small step gait, or have trouble turning as well. One thing that happens generally later in the course of the disease with Parkinson's is that sometimes they get very stiff. That's another key feature is rigidity. So they may get stiff, which can also include, the throat muscles as well. And also a lot of Parkinson's patients also complain of drooling as well. That often becomes a problem too because they can't swallow it as well, but they're still producing a lot of saliva. So that can become a problem as well. Anyone who has swallowing problems, that definitely needs to be, evaluated by your doctor and make sure there's nothing else mechanical going on to account for that. And obviously, if there's trouble swallowing certain types of food, like solid food, for example, it may be necessary to switch to different textures, like pureed foods or soft foods, that sort of thing.
柏金遜症由發現到而家已經差不多200年啦。咁究竟喺醫學界上面有啲咩新嘅進展可以醫到呢一個病？而呢啲治療又有冇副作用嘅呢？
Good news about Parkinson's disease is that we have a lot of effective treatments for the disease that can greatly improve the quality of life of patients, and as a whole, patients don't die from Parkinson's disease anymore because of these treatments. So the gold standard treatment is a medication called levodopa, or Sinemet, and what that does is that it basically directly replaces this dopamine, which I talked about earlier, that these patients are missing. It directly replaces that. So, and often, especially early in the disease, early in the treatment course, patients can do very well with this medication, and often with very low doses, their symptoms can be very well controlled for a period of time. So that's probably the most commonly used medicine. There are other medicines that we use that I would describe as dopamine lookalikes. So what they do is they're not dopamine and they're not like levodopa, but instead they act on the same receptors that dopamine acts on. So, so these medicines also can be very effective in treating patients as well. And then there's some other medicines that are also used that instead of replacing or compensating for loss of dopamine, they just make the dopamine that is already in the body last longer. So there's a certain so it inhibits the breakdown of dopamine in the body. So those are the type of medication we call MAO inhibitors. So this is another class of medicines that we also use.
食藥呢嗰種藥物呢係增加個 dopamine， 咁增加 dopamine 個理由呢就因為呢佢個病人唔夠嗰樣嘅鈣質啊嘛。咁個不幸呢就係增加 dopamine， 如果係太多嘅時候呢，個 dopamine 會影響個腦其他嘅地方嘅功能㗎，咁所以呢佢會變咗有幻聽幻覺，同埋呢有懷疑，同埋呢有時情緒不穩定咁樣，係呢個係事實嚟嘅。咁所以呢係好論盡咯，即係變咗呢，如果你要用嗰種藥嚟到幫助佢行動正常化，但係佢又有副作用嘅呢，咁就係比較討厭嘅事嚟嘅。
Since dopamine is part of the behavior pathway, sometimes patients who are on these medications, especially older patients who seem to be more sensitive to these side effects, they can develop, sometimes develop confusion, they can sometimes develop hallucinations, sometimes they can really develop changes in the behavior that make them look obsessive compulsive, or even act or sometimes act inappropriately. In some cases, especially these other medicines I talked about, these dopamine lookalike medications, there have actually been cases where patients become compulsive gamblers or compulsive shoppers because they get this rush and want to do sort of risky behaviors. So, so those are some less common side effects, but things to be aware of if you're on those medicines. Certain patients, what can also be effective is a type of surgery for Parkinson's as well, and these are. And generally, we reserve the surgery for patients who've had the disease for a while, still respond well to the medicine, but for various reasons, either they can't get more medication or they're having complications with the medication. There's a procedure called deep brain stimulation where it's basically like a pacemaker that goes to select specific structures in the brain that help compensate for the loss of dopamine that these patients encounter. So it's something that can greatly improve the quality of life of certain patients if they are good candidates for that. And they can often, with this surgery, they can also become less dependent on the medicines.
作為一個過來人，我睇住帕金遜症點樣慢慢咁剝奪一個人嘅功能。我希望知道究竟帕金遜症會唔會導致一個人嘅死亡嘅呢？
Well, the good news is that since we have a lot of medications, effective medications available for the disease, that generally the mortality of the disease is no different than it would be for, there's really no change in mortality for the disease. People generally now don't die from Parkinson's disease. Most patients will pass away from something else ultimately. A very interesting question about Parkinson's disease is they've done a lot of studies about these other epidemiological risk factors. It actually seems that, if anything, higher education seems to be a risk factor for Parkinson's for whatever reason. So that's something that came up very interesting. But generally, we don't know whether it's, there are environmental risk factors or genetic risk factors. I think there's probably an overlap of those things. But generally speaking, there's really no single identifiable risk factor that says that you're definitely going to get Parkinson's. I mean, if you have a family member with Parkinson's disease, there's only an incrementally increased risk of Parkinson's.
目前嚟講，帕金遜症嘅病因仲未係好明確，而醫學界仲未知道究竟點解有啲人會少咗啲 dopamine 呢一個多肽胺元素，而導致有帕金遜症。咁同埋有冇啲咩方法可以令我預先知道我會唔會得病呢？
A minority of cases, there is definitely a clear genetic factor. So then those patients usually have a very strong family history of Parkinson's. But for the vast majority of patients who I would see in my clinic, these patients, they're what we call idiopathic Parkinson's disease. And what we mean by idiopathic is we don't necessarily know why they got it, or it's just, could be a wide variety of reasons that we haven't identified yet. At this time, there's no way to do that. There's no blood test. There's really no practical radiographic tests. Like, you can't just get a CT scan of your brain and that would give us information. So at this point, there's really no way to identify someone, pre-symptomatically whether they're going to get Parkinson's disease or not. Although there's a lot of research going into that at the moment.
喺美國有一個帕金遜症協會，而佢哋呢一個協會喺波士頓係有一個分會嘅，係為大家提供資訊、轉介對病人嘅服務，同埋為照顧者提供支援。呢一個會嘅波士頓分會係位於715號 Albany 街，係近波士頓市醫院附近嘅。喺熒幕上邊有佢哋嘅聯絡資料。另外喺波士頓有2間醫院係有特別嘅中心，其中一間係波士頓大學醫學院，而另一間就係麻省總醫院，專門係為患有帕金遜症嘅病人提供服務嘅。帕金遜症係一個好普遍嘅老人病，喺後期患者可能會有妄想、失憶呢啲行為。一般嚟講，60歲以上嘅人每10個就有1個可能會患有帕金遜症。患有帕金遜症嘅人行動唔方便，喺後期仲會喪失運動嘅功能，呢啲都會令人好不安嘅。但係好似何醫生咁講，早啲發現可以早啲開始治療，咁樣係可以改善大家嘅生活質素嘅。咁喺下一集，我哋會同大家介紹一下社區裏邊有啲咩資源可以幫到大家。下一集見啦！